Hi everybody, back again with another Ultrasound of the Month video, this one captured by our very own Dr. J. This was performed on a patient who went up for a jump shot while playing basketball and came down and had an awkward landing and heard a pop in his heel. We wanted to look and evaluate the patient's Achilles tendon. We wanted to see if this was just a sprain or if the patient had actually torn his Achilles tendon. As with most things in soft tissue or musculoskeletal ultrasound, we always want to look in two planes. You'll take your ultrasound probe and you'll first put it transverse across the Achilles, like in the picture. You'll place the ultrasound probe on the back of the Achilles, and when you do, you see this somewhat oval hypoechoic structure that's the Achilles tendon, seen right here. Sometimes the transverse view can be a little challenging because there's not a lot of meat on the back of the Achilles, as the ultrasound probe keeps on slipping off, so sometimes you need to use a little bit more gel. You also notice a small black fluid collection in the superior portion of the Achilles as well. This should not be there. This is essentially what we're looking for, not only with the Achilles tendon, but any other musculoskeletal injury. Are there black layers of fluid representing tears that shouldn't be there? As we now scan more proximally up the Achilles, we notice that the black fluid collection, or tear, seems to get a lot worse. The next view that we'll want to see is the long axis view. Take the probe and turn it 90 degrees so it's now sagittal to the patient's body. This view is often a little easier to view and understand. As we start scanning, we see the longitudinal fibrillar pattern of the Achilles tendon, which initially looks okay. As we scan further, we again see a small black fluid collection, concerning for a tear. As we continue to scan more proximally now in the longitudinal view, we see what looks like a near complete tear of the Achilles with black fluid and irregularities through the entire tendon. It can be challenging to tell if this is a partial tear, a near complete tear, or a complete tear, and honestly, it's probably not 100% necessary to know. It's just helpful to tell the patient you've torn your Achilles and will need to follow up with orthopedic surgery on an outpatient basis. Alright guys, hopefully this was helpful. Let me know if you have any questions, and thanks for watching.